Yeah, I think let's get started. Maybe others can join. So, so we'll quickly recap what we discussed in the first class. I mean, the last class. So we discussed about 12 organs, right? So those 12 organs are lung. You have to remember the organ name along with the symbol. That is more important. So lung stands for LU. Sorry, LU stands for lung, and then large intestine. LI stands for large intestine. Then stomach, ST, stomach, that is stomach. And then SP stands for spleen, and H stands for heart. And you have SI, which stands for small intestine. And then UB stands for urinary bladder. K stands for kidney, and P stands for pericardium. SJ or TP, that stands for triple wormer. And you have GB, that is gallbladder, and LIV is liver. So these are the 12 important organs. Now, we also discussed that, while we have many organs in our body, why we are focusing only on 12 organs is because these are all the main meridians that are passing and energizing all these organs. So these are all the main important thing. Apart from this, there are two other organs. One is REN, sorry, not organ, channel. One is a REN channel, another is DO channel. So REN channel runs in the front and DO channel runs in the back, and they are not connected to any organ. So if you are familiar with these 14 channels or these 14 meridian, you are pretty much conversant with all the acupuncture points. So you don't need to know, any channels other than these 14 channel. Now we also discussed last time that how are these organs are how are these meridians are connected. So each organ has two meridians. Okay, so one on the left and one on the right side. So totally how many meridians are there? There are 12 types of meridians, but actually there are 24 meridians because we have one on the left and one on the right. So if you include the REN and DO channel, REN channel is on the front and DO channel is on the back. So we will see REN and DO in the subsequent class. We will not worry about that now. So we have totally 26 meridians are there. Okay. And when you select any acupuncture point, you can select either on the left or you can select on the right. It doesn't matter. Both are same. So for example, if you have cold, let's say there is a lung point you choose somewhere here. So you can choose this point either on the left hand or on the right hand. Both are same. Both are the same effect. So so totally there are 24 meridians are there, right? And where are the acupuncture points or where are the acupressure points? So this is also we saw some example. So they are primarily at the crease. So what is crease? When you fold your hands or when you fold anything, you can see a small line here, right? So this line is basically called a crease. So that is the crease. So most of the points are situated in the joints. See, there are many points in our body, but the points in our joints are very very important. Okay, so even though you have so many points all over the body, not all the points are very important, but the important points are in your joints. So this is one reason why you see the people who are active, who are doing a lot of physical work, they are always very healthy. The reason is because they do a lot of work. See, for example, if you see the people who are doing agriculture work or the people who are doing some groundwork, right? They do use a lot of equipments and other things, so they do move a lot of things, right? Even in those days, before we had this mixie, grinder, and other things, like these kind of things, household ladies used to do a lot of housework. So what happens naturally? All these joints get rotated, and that gives you a lot of energy, and that keeps your health in a proper condition. So, so even if you don't know any acupressure point, what you can do always you can rotate your joints. So every day morning when you get up, when you do some rotation of joints, right? So that will give you a lot of energy into your body. So most of the points are in the joints. So you have so many joints. For example, you have here one joint, right? These are all the joints. Now the acupressure points are on the joints. Then there are bones. You can see there are bones are there. Between those bones, there are many points. For example, we have our spine, right? So below the spine, behind the spine, you have on both the sides of the spine, you have urinary bladder channel. So that channel is very very important. Though the channel name says urinary bladder, it's not that it solves only the urinary problem, but it solves almost all your health problems. So, for example, if you massage all the points in the spine, so your spine has three portions. so which we will see in the subsequent class. So there are three portions, no? So it's called lumbar, thoracic, with that. So when you massage all the points, then all your entire organs, will get activated. They will get energized, and they will revive. If there is any problem, they will try to come out of it. So the joints are between the bones, and also the joints are in the depression. So what is depression? For example, we will see some points today. So you can, what you can do, you can try this. No, you see your hand is here, right? So you move your finger like this, okay, and once you cross here, here you can see there is a small, small pit kind of thing. So that is depression. So this is where you have an important point called TB5, or it is called triple armor 5. So it's a very, very important point. You can see this point. Okay, so you can see this point here. So there are many depressions in our body, and the points are there in the depression. So there are four. Let me just recap. So there are four places where the acupressure points are there. See, that doesn't mean they are there only in those places. They are there all over the body. But the most important, common places where you can find points are, one is that you have a crease, another is you have in the bone, between the two bones, and also in the joints, where you have joints, and also in the depression. Okay, so today let's see some 3 4 points which are very important. So first point is called LI4. LI, LI stands for large intestine, right? So LI4 means, like, how to find LI4 is very simple. See, for example, just give me 1 second. Yeah. So you can see here, right? When I keep my finger like this, and then when I fold my keep my thumb, like this, you can see here there is a portion, bulging portion, correct? So this bulging portion has some, what do you call? This is with the highest point, right? If I keep my hand like this is my highest point. So this is where LI4 is there. So this is a very, very important point, because we will see the different types of point, what are the different effects in the subsequent class. But this is a very important point. When you press this point, if you find a small pain, then it means, like, you have a lot of toxins in your body, and this is a very important point that you can. So, for example, if you have any fever, or any pain, body pain kind of thing, you can use LI4. It's a very, very important point. The next point is LI11, large intestine 11. Large intestine 11 is very simple. So you can see here, when I fold my this thing, I see there is a crease, right? Just at the crease. You can see here there is a crease here. At the end of the crease, there is a point, and this is called LI11. Then TB5. TB5, like I told you, like, just move the finger here like this, and then when you cross the wrist, then you can see the bone will end somewhere, and then there will be a depression. So that is where TB5. So there are many, many points are there. So you can, we'll not discuss each and every point in this class, because I already given you the app, so you can go through the app and you can understand everything. Okay. So now let's see a few other things about these points. So there are 12 channels are there, and these 12 channels are basically organized into yin and yang. So this yin and yang also we discussed in the previous class. So what is yin, what is yang is, these are all two opposite forces or opposite energies in our body. So for example, when you are sleeping, your yin energy is more. When you are awake, your yang energy is more. So when somebody's yin energy is more, what happens? They are kind of very sluggish, or no, they are not active, like that, right? So for example, in the night, you don't feel like doing a lot of work, except for people who are working in IT. Other people, generally after 7 or 8, their energy goes down, right? That is because their yin energy is more during the night time. Similarly, in the morning, somebody's yang energy will be high, right? So basically, this yin and yang are very, very important. They are always in balance, and they keep fluctuating between yin and yang, like that. And whenever there is a imbalance in this energy, say for example, as people grow old, right, their yang energy comes down and their yin energy becomes more. So that is why you see the old people, they are not very active. Whereas at the very young age, the kids, they have more energy, because their yang energy is more. So now let's understand how diseases are happening. Okay, so what happens when this yin and yang are not in balance? You get diseases. So there are two types of disease. So one is the disease that happens because yang is more, another one disease which is because yin is more. So, for example, let's say somebody has very very high fever, right? So how are they? They are very restless, right? They keep moving here and there. They keep shouting. So they're not they are very very overactive, right? So fever is basically nothing but a problem because of a high yang. Okay. So similarly, if somebody has diarrhea, right? Diarrhea. So because of diarrhea, what happens? There's a huge energy that will be there. But on the contrary, if you take some other diseases, so there, you will see the energy will be very very less. So you can get diseases because of both the cause. Like if yin is more, also you get diseases. If yang is more, also you get disease. Now let's say if yang is completely very very high, right? Then you get some diseases, but they don't cause death. But when your yin energy becomes very more, then they will cause you death. So, for example, if your yang energy completely becomes zero, it's a completely yin energy, then basically you either go into a coma stage or the death happens, something like that. So basically, this yin and yang should be in balance. Now there are 12 organs are there, right? We discussed about 12 organs. So these 12 organs are categorized into yin and yang. So basically, we talked about Zhang and Fu. I think if you have seen the Word document that I sent you, you can, if you're not seen it, you can just go through it again. So organs are also classified into Zhang and Fu. So Zhang organs are basically connected to Yin channel, and Fu organs are connected to Yang channels. So what it means is that that those channels which are connected to these organs, right? They carry the Yin energy, and then they go to that particular organ, and the organs, the Yang channels carry the Yang energy and go to the different organs. So these organs are basically, they are complementary to each other. And the most important thing is this yin and yang. No, they are very what do you say? They don't flow in the same fashion. For example, the important aspect of yin, that is white. So one important aspect of yin is white, and another aspect of yang is black. So what it means is, see, for example, if I keep my, because see, it may not be visible here very much, but if you see generally, the inside here, this place of the arm, right, this will be always white here, right? Whereas if you see here, this place of the arm will be little bit black, right? So most of the people you can see that color difference. So what it means is that this is where you have all the in channels that are coming here. So in channels are always going on the, what do you say, they are always going in the they always in the inner side of the body. Okay, so similarly, I have given the notes. You can see the notes and understand how. So these yin channels and yang channels, they are always not same. So they are little different. For example, certain channels may be in depth, and certain channels may be very superficial. So why they are so is because of the yin and yang. So if there is a yin channel, they will always go only in the distance. See, for example, there are 6 channels in this hand, right? So lung channel is there, which is inside, whereas large intestine is on the outer side. See, for example, here you have. So I'll give you one another channel. Sorry, another point. You can see here, right? So there is a point here. You can see here, right? So if you have any lung infection, right, what you can do is you just keep the uh, hand. You can see there is a bone here, right? So in this bone, you just see there is a small depression at the edge of the bone. You can see a small depression. When you come inside, right, somewhere here in the center of the bone, when you press, if you have some pain, it means like your lung is not working 100% active, which means like it doesn't mean your lung is having some problem. Don't imagine like that. But what it means is your lung either it is little bit deficient on energy, or maybe there is a lung infection kind of thing. So you can see here, you can see there is a small pain. So similar. So see, this is lung channel, right? So lung channel flows inside, whereas the large intestine channel, they flow outside, right? That's what I told you, right? Here Li4 and Li11. So what it means is that there are 12 organs which are categorized into Zhang and Fu, and which are Yin and Yang, right? And these are all, for example, if you take lung, there is a large intestine. So that's all. So lung is basically Yin, and large intestine is Yang. So this is how the channels are situated. Now, uh, one second. Now, how are these channels connected? So there is a particular fashion pattern in which these channels are running. So that also I given in the document. So what is the pattern? See, for example, all the channels, they will end or they will start in the limbs. So, for example, it can be here in my finger, right, or it can be in my foot, at my finger, right, limb. So these channels are starting somewhere and they will be ending here. The only two exceptions are Ren and Do channel, which doesn't start or which doesn't end in the distance. So all the 12 organs, their channels will start or end in the limbs. So there are different types of points. Today we'll just see one important point called Jingwell points. So see, there are Chinese names. So I'll give you some Chinese meaning also so that you can understand later. But these are all called Jingwell points. So these are all very very important points. So these are very active. They are very important. If somebody is in some acute problem, they have some problem like coma or asthmatic attack, something like that. These points are very very useful. So they are. See, acupuncture not only helps you to take care of a chronic problem, it also helps you to take care of the acute problems also. Okay, so this is what we discussed, right? The difference between acute problem and the chronic problem. So these jingle points are very, very important. So what it means is that these channels are starting somewhere uh, they start inside the organ. So the channels are starting or ending in the organs. So for example, you can see here lung channel, right? So lung channel, you know where is your lung, right? You have a lung here. So the channel goes inside into the deep into the organ, and then it starts from there. So you can see here, I'll give you the location of all the points later. So you can see somewhere the lung channel starts here. So this is lung one, right? So the lung channel goes like this, and then it ends here. So you can see here the lung channel goes like this. So the lung channel starts from here. Now, see, this is in channel, correct? This is in channel. So it doesn't mean that all the in channel starts from here. No? There's a rhythm. So you can understand that later. So the channel starts from here and ends from here. Now, on the contrary, so what is the combination for lung? That is large intestine, right? So if you read the document, you can see lung and large intestine. So large intestine, what happens? That starts from here. Okay, so that goes like this. It goes like this. Okay, so basically you see one channel starts from the organ, right? It starts lung channel starts from the organ, and then it goes like this, and then it ends here, right? It ends here in the finger, and the next channel starts from the finger, and then it goes to the organ. So this is how all the channels are there. So for example, if you see here, there are three important channels here. So we have lung, pericardium, and heart. So these are the three important channels. But on the other side, you can see here there are three other channels. So similarly, if you see, inside here in the leg also, you have an inside and outside. So in channels are going in the inside, and yang channels are going the outside. Okay. So any doubt you have? Okay. So let's see more about these channels. Give me 1 minute. Just 1 second. Okay. So So the most important thing that we need to understand is that we need to first remember what all these 12 channels, right? So today I will just give you an overall idea about how acupressure can help you to identify the problems and how acupressure can help you to solve the problems. So first is we need to have knowledge of the 12 channels, right? Then we need to have some idea about which of the channels are in and which of the channels are yang. Okay, then once you have this understanding, right, You also need to have some understanding of how the channels are flowing. See, for example, like I told you, one channel starts from here and it ends here, right? The other channel starts from here. So basically, if you see, there are 12 channels are there, and they are classified into six different channels. And if you see six channels, they will connect here on the hand, and six channels they will connect on the leg. So this you can see the document that I gave you. You can understand six channels connect in the hand, six channels connect on the leg actually. So you need to have some idea about where the channel starts and where the channel ends. So why is this important? Because the points, like I told you, these points, you need to have some idea about how the channels are flowing, right? You already have the app. I already given the app. We'll talk about the app in the subsequent session. So you can go through the app, and from the app, what you can do is like if you have some idea about the channel, then you can, for example, you have a lung related problem, right? You have, let's say, asthma, or you have some cold attack or something like that. You have some respiratory problem. So you can choose some points on your lung. So for example, there is a point here. So there are many points are there on the lung channel. You can choose one of the point, but for that, first you need to know where the lung channel flows, right? So that's very important. So if you go to the books and all, they will give you some points, but those points are they are very very minimal points, but there are many points are there. So first knowledge we need to have is the channel path knowledge, huh? So where the channel starts and where the channel ends. And for that, you can just remember like this, that six channels are flowing in the hand and six channels are flowing in the leg actually. And another important thing, like I told you, one in channel, wherever the in channel ends, right, there the yang channel starts. For example, like here the in channel ends and then the next channel starts. So something like this. You can go through the book and understand the thing again. So what is first important? You need to have some idea about the knowledge of the this thing, and then you need to have some idea about the points. What are those points? So the points I will give you. So again, in the points we discussed, two important aspects. So one is called the classical theory, another is called the clinical theory. So in the classical theory, we will see more in detail in the subsequent classes, but I'll give you some idea today. But in the clinical theory, that's very simple. There are some points people are tested over a period of time. So, for example, if somebody has a fever, it is very clear that you can use LI4 and LI11 because this has been tested for quite some time. So, for example, if somebody has fever, if you keep massaging LI4 and LI11 three times in a day, their fever will come down, and they will maybe in 3 4 days they can become better with help of some medicines. So you can try that. For example, if somebody has fever, generally in acupuncture, we'll put needle on these 2 points. So they will become better. So similarly, if somebody has a lung-related issue, we'll put needle in the lung channel. So basically, that is clinical acupuncture. But when you come to classical acupuncture, so we will use a different technique. So there, what we'll do, that's where we will understand why the diseases happen. Today, let's discuss about why diseases can happen. So, first reason I already told you, disease can happen because yin and yang energy problems, right? For example, let's say this is the lung channel, right? Here, the yin energy is more. So, what will happen? The person will have breathing related problems, right? That he will not be able to breathe. Some issues may happen. So, what you do, you choose certain points here and you do needle so that yang energy becomes more. So, when yang energy becomes more, what will happen? Yin and yang will get balanced, and the disease will slowly start disappearing. So, this is one example. Now, how will you know yang energy is more or yin energy is more? That is by disease. So, for example, certain diseases, like I told you, fever, these are all young diseases. So there are certain diseases which are young, certain diseases which are yin. So by if you understand the classification, then you can know which are all the points that you need to treat. And all the diseases are connected to some organs, which is quite obvious. For example, if I tell you respiratory problem, then that is connected to lung. If I tell you, certain motion sickness or something, then they are connected to large intestine. So something but there are many diseases where you may not know which points are connected to this thing. The organs are connected. For example, diabetes. So diabetes, there is no organ in this 12th channel, right? But we have spleen. So pancreas is the organ which has a problem related to diabetes, right? So pancreas and spleen are same. So this kind of knowledge we need to have. So once you have the idea of the channels, the points, so you don't need to remember the points because app is already there for you, and which organs are related. Then you can select the points. Now there is a theory behind selecting the points. So before that, let's understand why disease happens, right? So first problem I told you that yin and yang are not in balance. Second is uh, there is a five element that I told you, right? Maybe let's talk about some five element today to a little bit. So what is five element? Five element means like Panchabutas, right? So the entire universe is made up of this five element, right? And we are also miniature of the entire universe, right? So we are also made up. See, for example, if you see, uh, take Earth as an example, right? 60% of Earth is covered by water, right? Similarly, if you look at our body also, we have 60% of water. Now, let's say if this water ratio increases, you will get certain diseases. So, for example, your mucus will increase. You may get respiratory problem, these kind of issues. But when your water level comes down, then you may have different kind of diseases like constipation. Then your BP can become altered. So certain problems can happen. So what is important is that these five elements. What are these five elements like we discussed, right? So these five elements are very important, and these five elements should not change in their proportion. So they should be in the proper proportion. Once any change happens in the body, then a particular disease happens. In the first class we discussed, right? Diseases can happen, because of either external reasons or internal reasons. It can also happen because of virus or bacteria. So, for example, when the climate changes, right? Obviously, these five elements also will change. So you may get some problem. So basically, we need to understand, what are these five elements and how these five elements will create a problem. So now there is a difference between the way five elements are defined in our Indian uh, system versus Chinese system. Indian system is a bit difficult to remember. We have five elements, right? Uh, I think most of you know, right? So I don't want to go through that. So let's talk about only Chinese system. So in Chinese system, we have five elements. Now the way they are structured is you can just get a small story and remember those points. So does anybody know what are the five elements in Chinese? Any idea? Any clue? Okay. So I'll just give you the elements and I'll tell you how to remember also. So you can remember it very easily. So let's take the first element, which is Earth, right? What is Earth? Earth is, see, for example, let's say it rains. Okay. When it rains, what happens? Your Earth absorbs all the water, right? When the water becomes excess, then Earth cannot absorb, then water start flowing in the Earth. So similarly, Earth means in our body, it has a capability to absorb excess, water, those kind of things. So that is Earth. Then next to Earth, we have wood. Okay, so wood. So wood has certain characteristics. Okay, so next after wood, we have fire. Okay, so then after fire, we have metal. Right. So what are the points we discussed? So first point is water, right? And the second point is, one second, I'll just see if I have a PPT here. Just give me 1 minute. Okay. So fine, I don't have. So I will just explain again. So Earth is one element, right? We discussed about Earth. Earth is a very basic element. So next to Earth, what you have? You have uh, uh, water, right? So water is there, and then you have wood, and then you have fire, and you have metal. So now, how do you remember this? Five things. So the way they are structured. See, but in our Indian, if you see, there is nothing called metal. There is nothing called wood. So it is called air and akasha, right? Ether and air. But here in Chinese, they are calling it as fire. Sorry, they are calling it as what you call metal and wood. So the reason why they have done it is because you can just understand how the evolution of the earth has happened. So imagine like the entire earth, let's say it was under huge fire, right? And after the fire, no, how the entire universe got formed, right? So maybe some big planets might have got busted, and then they become small planets. It were very hot, and then they become very cold, right? And then the earth was formed, right? Now once the earth is formed, what happens? The you have a lot of greeneries that start coming in the earth, right? So after the earth, what is there? It is wood, right? With the help of wood, what you can do? You can actually cook. People started creating fire. That's how first they started. When they started lighting with the help of the stones, then they understood that there is something called fire, and then they started using fire with the help of wood, right? So you have earth, you have wood, and then next you have fire. Now then you have metal, and then you have water. So metal, say for example metal, you can imagine like ice. Ice is like a metal. So when it melts, what happens? Then you get water. So they are created in this structure. So that's how, because if you talk about air and ether, you cannot understand, or you cannot imagine. So Chinese are given this kind of five elements. So these five elements are, I'll just repeat here. So these five elements are: first element is earth, the second element is wood, and then you have sorry, first is earth, second is water, and then wood, and then fire, and then metal. So this is how the five elements are there. Now why are we talking about these five elements? Is that in all the channels, right, we have many points. So in each of these points, these energies are flowing, and they are making sure that these five elements are proper in nature. So when any element becomes less, right, then what happens? Your body will start having some diseases. Like I told you one example. We talked about Sanjio channel, right? What is Sanjio channel? You have a fire here, here, and there is a lower portion, there is a middle portion, upper portion, right? And we also talked about pericardium, which is ensuring that your heart is kept warm, right? Now let's say if this fire, any of this fire becomes less, which means like your fire element is less, then what happens? When fire is less, certain problems will start coming. So for example, your body will become chill. It may not be able to generate enough energy. For example, when fire is less in our stomach, what does that mean? See, don't imagine that there is a fire there. Basically, what it means, fire means like we have digestive power, right? How do we get digestive power? For example, when you eat something, then hydrochloric acid is secreted. So this hydrochloric acid, what does it do? It helps you to break down the particles so that it can be easily digested. So that is what is called fire actually, right? So for that, your body has to kept under certain temperature. So when that fire goes down, what happens? You get indigestion problem, right? So similarly, see, when indigestion problems becomes more, then what happens? That becomes acidity, right? When acidity becomes more, it creates certain other problems, maybe diabetes, even sometimes certain types of ulcer, or some cancer, those kind of things. So you see, essentially the reason why you are getting some problem is because the fire is very less, right? So similarly, all the points need to maintain the balance of these five elements. Now, if these five elements are not in proper ratio, then you get some problem. And once you know those points, right, what you can do? You can do needle, and you can actually treat those points. So for example, like let's say when there is a less fire in lung, right? So there are certain points in lung you can choose where you can do needling. When you do needling, what happens? The fire will increase, right? Or for example, let's say there is too much of water in lung, right? Which means like, what does it mean? Your water content, in the lung channel is very high, right? So how do you reduce it? You can, what you can do, you can increase certain other element so that that water is absorbed. So what is that element? That element is pretty simple. That is earth, right? So when earth is increased, then what happens? This excess water will be absorbed. You can imagine like this, right? It's very easy to imagine. So if you know the disease, if you know the organs that are connected to that, and if you know which are all the channels, and if you have some idea about what are these channels and what are these points, then you can actually do the needling. Now there is a difference between classical acupuncture, and there is a difference between the clinical acupuncture. So in clinical acupuncture, we put so many needles. So you have to use at least, if you go to the proper acupuncture hospital, they will put 24 needles. Similarly, if you have to do acupressure, you have to massage so many points. See, that's one reason why if you use any book and try to do massaging on your own, it doesn't help you, because you have to massage, all the points. So you need more number of points. So this is clinical way of treating the problem. But when you go to the classical way of treating the problem, you don't need to choose so many points. You can just choose only some 1 or 2 points. So, for example, like in one of the class, I think I told you how acupuncture became famous in the entire U.S. The idea is that the reason is because when the U.S. president came, he had a problem with the help of one needle. They made the that his this thing to shrink. Actually, he has appendicitis and it shrunk. So that's the power. So the power of clinical acupuncture, so the power of classical acupuncture is that you can choose 1 or 2 points and you can treat those points. But then the question is why people are not using classical acupuncture? Why are they using clinical acupuncture? Similarly, when you come to acupressure, also we can use both classical method and we can use clinical method. So why can't we use classical method, right? Because if with help of one thing I can solve the problem, why should I choose so many things? The reason is because for using clinical acupuncture, you already somebody has done the homework, right? Somebody has tested everything they have given you. So the points are arrived, the protocols are arrived. By the reason that how they arrived the protocol is that when who started recognizing acupuncture as one of the treatment methodology, a lot of people all over the world, people from China, Sri Lanka, India, France, UK, US, Canada, all of them have tested these problems and they have come up with some protocols. So, for example, if somebody has a problem, I'm going to treat them. I will be simply relying on the points what they are. So, it is very easy to use clinical acupuncture or clinical method of acupressure. But for treating classical method, my biggest problem is I need to choose the points as per the problem. For example, if let's say somebody has high fever, okay, somebody has high fever, and this person has very dry cough, okay. So can somebody tell me whether the lung has excess water or something else? Just guess, no, you can guess, right? Somebody wants to give a try.
No, it is a less water.
Okay, what else is high? Okay, less is fine. What else is high there? What else could be high?
There is more heat, I think, in the body, sir.
So there is a fire is more, right? So fire is more. That's why he's getting a dry cough. But let's say if somebody has a fever and that person has a lot of sputum coming, or his lung is completely congested, then it means what it means. It means that that person has more water. See, the problems are same as per the if you go to any English doctor, the problems are same for him, right? The person has a fever. This person has cold or some problem, right? He has some infection or something. Let's say the problem is same as per the allopathy, but as per acupuncture, these two are not same, right? If somebody has a dry cough, then the reason is because the excess heat is there, so the lung cannot tolerate that heat. That is why he has a problem. Whereas on the contrary, if somebody has a lot of cough with this thing, then it means what it does mean. It means that this water content is more. So now you cannot blindly choose some points and you cannot treat. So what you have to do, you have to understand which point to treat. For example, when a person has more fire, what point we can choose to bring the fire less? If we increase something else, the fire can come down, right? Can somebody guess which one you can increase to reduce fire? Very simple.
Water.
Water, correct. So if you choose some water point and then you try to increase the water point efficiency, then what will happen? The water energy will become more and then the fire will come down. So what will happen if somebody has a dry cough? Then you have to choose that point and you have to needle. So to use classical acupuncture, you don't need any knowledge. You can simply use. But for clinical acupuncture, you don't need any knowledge. But for classical acupuncture, you need to have an understanding about. See, because this is very simple. I just give you. It's very easy to understand, right? We can imagine, what might happen. For example, if somebody has constipation, then water is less in their body, right? So same thing we can relate. Maybe their large intestine channel has less water, right? So you have to increase the water of certain points. So that's how you have to do. So it's not very easy in classical acupuncture. The other important thing is we also need to understand that why diseases are happen. I told you there are 12 organs, right? Out of which 6 are yang and 6 are yin. So we have something called an organ clock theory in Chinese, and the same thing is there in our Ayurveda also. But we don't use it anywhere. But in acupuncture, it is very used, very effectively. So what is this organ clock theory? Is that when this energy is flowing all over the body, okay, and when you do inhaling and exhaling, there is a respiration. The energy goes out and goes in through chakras. But not only that, the energy keeps flowing in our entire body. And this Ren channel and Do channel are like some kind of what do you call, some waterfall. So this energy keeps rotating behind your this thing. It keeps rotating like this. And when this energy rotation has some problem, then you get some disease. So similarly, wherever there is energy problem, you get some disease. Now, uh, what is very important to understand is that this energy flow happens in some direction. So, for example, lung channel, I told you, right? Lung channel starts from here. So it means like lung channel is like this. So the energy may flow like this. So there is a direction. So I will give you the direction also. Don't worry in the subsequent. So what will happen? Every 2 hours. See, we have 24 hours in a day, correct? And we have 12 organs. See, that's why they selected only 12 organs, right? You see how everything is fitting perfectly, right? So there are 24 hours in a day, and every organ gets 2 hours to get maximum energy. See, that doesn't mean that those channels don't have any energy, but during that time only you get maximum energy. So what it means is out of 24 hours, 12 organs get 2 hours each for that time. So this clock is called organ clock. For example, between 3 to 5, okay, between 3 to 5, what happens? Your lung energy is very very high during that time, right? And even in our this thing also, it is called the Brahma Muhurta, right? The reason is because that time you have to be awake. Why you have to be awake is because lung energy tends to be more, and if you are sleeping, then your energy flow doesn't happen properly. There is also another scientific reason, because that is the time when ozone layer is completely depleted and it start replenishing by 4 o'clock, right? So these are all all connected to each other. So each of these organs get 2 hours and the energy flows. So if you do something not related to that particular time, then it creates a problem. For example, let's say you don't get a good sleep between 11 o'clock to, let's say, 3 o'clock, right? Then those people get problems related to skin diseases. So those people get problems related to many problems like constipation. Their immunity level goes down. So many problems happens. Now, while generally people can say that you have to get a good sleep, what is the scientific reason? That is the organ clock theory. That is because the channels, like you have channels like liver, right? Your spleen. So there are different channels out there. So each of these channels, what they do, I think if you read the one-page document that I gave you, you can see there, what the each channel does, right? So the channels like spleen, all these things, they are important to to remove the toxins from our body. So when you are not sleeping that time, then what happens? Those energy is not used for that purpose. So that energy is used for some activity. Say, for example, you are working in the night, or you are doing some work. Then that energy, what is flowing into your body from the cosmos, right? That energy is not used by those organs, but used by something else. So what happens naturally? The toxins are not removed. So when toxins are not removed, I told you, in the theory, right, how the diseases are happening. So what happens when the toxins are created more in your body? Your body tries to send out the toxin, but since the toxins are not able to be, because these organs like liver, spleen, they are not working fully. These things are not, organs are not able to send out the toxins. So what happens? Those toxins start building up. So what it does, the organ, the human body is so intelligent that they store the toxins somewhere outside, so that none of the organs are impacted. So first symptom is you start getting a lot of skin related problems. Then what happens? Those toxins, it's like if you keep some garbage, like I told you earlier also, right? If you keep some garbage, the quick thing you can do is just push it under somewhere or put it in the corner, right? So that your house looks clean. But if the garbage is not removed and the garbage keep increasing, what will happen? They will just start accumulating all over the body, and then your liver and spleen and all will get damaged. So that's how the disease happens. So what is important? these 12 organs, they have to function properly. Now, what is the correct time to do needling? The correct time to do needling is when the energy is more. Correct? When the energy is more, that is where you have to do the needling. So, the most important problem about classical acupuncture is that clinical acupuncture you can do anytime, but if you want to do a classical acupuncture or a classical acupressure, then I need to do that particular time so that I can get maximum energy. So this is the difference between classical acupuncture and clinical acupuncture. But fortunately, see, for example, there are some hospitals. Let's say you cannot, go to the hospital in the 3 o'clock in the morning and say, between 3 to 5, my lung energy is more. I want to, I want to take acupuncture. That is not possible. But what you can do, you can get up in the morning, 3 o'clock, and then you can, if you know which are all the points you have to massage for your lung-related problem, if you have asthma or any problem, you can do. So, so it is important that you should understand this theory, right? So I'll just summarize again. The classical acupuncture employs techniques like why the disease is happening, right? What could be the reason, and what organs are related to the problem, and why the energy, why the disease happening. Is it because of low energy? Is it because of high energy? Like I told you, yang energy is high or yin energy is high, and similarly, whether these elements are causing any problem, right? So these are all the different mechanisms that you have to understand. Once you understand this, then what you have to do, you have to select the point. So point selection is very, very difficult. So that also we'll see. So in this class, what we are going to see is, in this next 3 months, we are going to see very, very important aspect of what are the points, right? How to choose those points for what diseases, right? So what we will not be doing in this classes, no, we will not be talking about diseases because there are so many diseases we cannot cover. So you will have I will give you some assignments, through some things, sites and all. You can try to understand by yourself. So what you can do is you can do some research and understand about disease. So if you have some idea about why the disease is happening, then if you have some idea about the channels, and if you have that idea about those points, for example, let's say there is a somebody has fallen down, so they are unconscious. So what do we do? So there is a point here. So between the nose and the lip, here there is a point. So when you massage this point, in 2-3 minutes, the person will get up. So that is the power of this point. So there are so many points. Now I can tell you, what is the point number. So what you can do, you can go to the app, you can find out from the app, and you can do this. So that's what you are going to do in the next 3 months. So any questions here? Okay. So so what we are going to do in the subsequent classes, that first we are going to understand about all the 12 channels. Okay, what are these 12 channels? How do they flow? We are going to understand about the structure of these channels. Where do they start? Where do they end? But what we are not going to worry about is what are the important points. So that we are not going to worry. So focus is only on channels, only on how the channels work, right? And we will also see about diseases that are related to those channels. So that is the first part. Then the second part is we are going to understand about different points. So there are different types of points. So for example, I'll give you some example. There is something called horary point. So what is horary point? We will discuss this more in detail, but I'll just give you some example today. So the horary point is something that which is very effective when you massage during that particular time. So for example, every channel has one horary point. So lung also has one horary point. So when you do massage on the horary point at that particular time between 3 to 5, you will get maximum relief, right? So for example, the same point you try to do massaging at any other time, you may not get that much relief or that much improvement. But when you do massaging exactly at that particular hour, right, you can get maximum benefit. So these are all something that you can learn. So there are different types of points are there. So there are 5 element points are there. There are horary points are there. Then you have jingle points. Then you have certain other points like Z-clef points. So these are all the points that will come in handy when you have some emergency. For example, in the middle of the night you have diarrhea. So what you can do, right? You cannot go to a doctor. So if about honey, right? So right, honey can treat both constipation as well as honey can treat both diarrhea also. So for example, if you have diarrhea, what you can do, you can take 2-3 spoons of honey as it is. So that will treat your diarrhea. But if you have constipation, what you can do, you can it won't solve the constipation, but it will not create constipation. So if you don't want constipation, you want to consume honey, then you have to consume in hot water. So if you have some knowledge about this, we can do. But there are many problems like this. So if you know those particular points, right? If you know which point, when you massage those points some 3-4 times, you may get some better relief. Let's say you have some serious pain somewhere. So if you know which are all the points related to that, that is called local points. So wherever there is a problem, the points around that is called local points. So if you select those points and you do massaging that time, you can get immediate relief. So acupressure, you can use it more like first aid, or you can use more like some pain management. You can do like this. So, but for that, we need to study about the points. So that's what we are going to discuss about. What are the different points and how these points are going to be used. Okay. So I think with this we'll stop here. So if you have any questions, we'll discuss. So otherwise, I think we will see in the next class.
Sir, one thing, because you mentioned about honey, like how to identify which is the, pure honey or something, because
See, generally honey is adulterated with sugar. Okay. So you can search in Google. If you drop one honey in water, okay, if it is sugar, it will get diluted. It will get dissolved. But if it doesn't dissolve, then it is pure honey. There are many tests are there.
Okay, if it doesn't dissolve, it is a pure honey, sir.
Yeah, correct. Because if it has sugar, it will immediately get dissolved. Actually.
Okay.
It will take some time for honey to get dissolved. You can do a lot of tests. I think they have a lot of tests. Food alteration itself is a big topic. So you can buy those kits at home. We can do education. So actually, I think there are some standard kits are available.
Okay.
I have not tried it, but I heard about it. So for example, you can test whatever turmeric we have, whether it is actually adulterated or not.
Okay.
So,
Okay.
you can take some little bit of water. You can add calcium to it. So calcium means like you can use Sundamun solver.
Okay. Okay.
You can add turmeric. If it becomes red, it means. So I think there are many tests.
Okay. Okay.
I'm not very familiar with all the tests, but honey, I think you can definitely check.
Okay. That is a solution, whether it is solvable or not. Okay. Okay, sir. Thank you. Thank you so much, sir.
No problem.
Yeah, I just wanted to ask one thing. Like you said, for diabetic, like the spleen, that channel has to be worked, and like nowadays you find almost having this problem. So if we work on it, can we reduce our sugar level?
Yeah, definitely, madam. But like I told you, that acupressure has certain limitations, right? Acupressure has certain limitations, so you have to apply acupressure more frequently. So, see, for example, if you do acupressure for some 2-3 minutes, it may not help you. You have to do more. Probably you have to spend 1 hour, 1.5 hour in a day. And if you continuously do, definitely, your spleen will.
In 1 hour means it should be done continuously, or we can break it into 15 minutes. And
You can break it into some 3 sessions or 4 sessions, and you can see it doesn't. 1 hour means like I just give you some guidance, some rough idea, right? But you have to choose all the points. You have to give enough concentration on all the points. If let's say there are 15 acupuncture points are there, right? Those points you are going to massage. You have to choose all those points and spend at least 1 or 2 minutes for each of the points. You have to do it some 3 times, 4 times like that, and you have to continuously repeat this protocol 3 times in a day or 4 times in a day. When you do it continuously, over a period of time, again, acupressure is working at energy level. So when you do it in 1 or 2 days, you will not find any big difference. But over a period of time, like if you continuously do for 1 month or 2 months, then definitely you will definitely see some improvement. I'll just share one feedback that people gave me last time. I think I posted that in the website also. That one person did it, and she told that she did it for almost 1.5 hour in the day she spent, and she told that she was able to reduce her sugar level.
Oh,
But one caution that I want to tell all of you that don't discontinue your existing medication and rely on acupuncture. The reason is because see, we don't know what stage your disease is. Right? If somebody has a disease, we don't know at what stage it is. Is it an early stage? See, there are certain cases where acupressure or acupuncture will work faster. There are certain cases where it will not work faster. So this is called prognosis. Prognosis means like you can just guess how the disease is going to work. So, for example, if somebody has a problem, okay, so he will come up with some 10 different issues.
Yeah.
Some of them could be symptoms that started a bit early. Some of them that came very recently. So these kind of. So when you do acupressure or acupuncture, if you see one or two problems that are coming down, then it means acupressure is working.
Okay.
You can do only prognosis. But what you cannot do is you cannot do diagnosis. Right? You cannot find out why that particular disease is. Correct? So for that you have to probably go to a lab, and find out. Because there are many problems which you cannot easily understand. That is one. Second is even prognosis also very difficult. You don't know how the disease because you are relying only on symptoms, right? For example, I myself have gone through this problem of diabetes, so I know when my sugar levels are high. For example, after eating food, when I feel sleepy, then my sugar levels probably are very high. There is soul feet burning sensation. I know that doesn't mean that you can perfectly check. So that's why it's very important that if you have some treatment, you should not stop the treatment and fully rely on acupressure or acupuncture. Right? Because if you go to any doctor, first he has to do a diagnosis. He has to find out why the disease is happening, right? And second thing, he also need to able to tell you how the disease is progressing. So this diagnosis and prognosis are very important. So if you do any treatment without worrying about diagnosis and prognosis, you may end up in some problem. That's why we tell that you should not buy medicine on your own and do it. It's not because of side effects. It's also because that it should not create unnecessary problems.
Thank you so much.
Sure. Okay, so I think we'll stop here, and maybe tomorrow we'll have again this session, session. So I'll give you some documents. So maybe in the next session, since not many people are here, maybe they forgot about this session. I think probably. So in the next session, we'll cover more. So today I just talked only about some themes. But in the next class, when we continue, I will give more points, give you more idea. I will also publish certain points so that if you've gone through all the classes, and maybe from next class you can start practicing for some of the problems on your own. Okay. Okay. So good night, everyone, and
Thank you so much.
Good night. Thank you so much.
Thank you.